Hello, my name is Remy, and today we'll talk to you about hip dysplasia in dogs. Hip dysplasia, as the name indicates, is a condition affecting a dog's hips and that will cause weakness in the rear end. Hip dysplasia can be transmitted genetically, but can also develop in dogs with no history in the family because of inappropriate activity, diet, or lifestyle. It will develop during growth if the head of the femur doesn't grow at the same rate as the socket in the pelvis it is supposed to fit in, causing an ill-fitting joint. The femoral head, also called the epiphysis, is the expanded end of the long bone that is the femur. Because it developed during growth, larger breeds are more at risk due to faster growth than smaller dogs. For example, Great Danes, German Shepherds, or Boxers are very high risk of hip dysplasia. But it doesn't mean that smaller dogs are safe from it. For example, French Bulldogs, Pugs, or Pomeranian are also genetically predisposed to it. The clinical signs of hip dysplasia are centered around the rear end being painful and weak, and will be divided into two categories, acute and chronic. Acute symptoms are symptoms that suddenly develop on previously healthy patients. It will generally be decreased energy, pain and discomfort when standing up or sitting down, when walking or running, when jumping or climbing stairs, for example. Chronic symptoms will be long-lasting or recurring symptoms, such as reduced activity, leading to lethargy, muscle atrophy, meaning the muscle mass of the rear end will slowly reduce due to inactivity, weight loss, depression, and generally weak back legs. In older dogs, left untreated, the symptoms can cause severe decrease of the quality of life and reduce life expectancy. There are a couple of steps to diagnose hip dysplasia. The first is a physical examination, where the range of motions of the rear end is being assessed. The dog will be standing up or laying lateral on its side, and we will look at how far the legs can move. A reduced range of motion will be the first clue leading towards a diagnostic. The goal here is to see how far the leg can be manipulated without the dog being painful. For this example, we will lay the dog laterally on its side. We want to focus on the hip joint, but we will do the same exercise for any joint of the leg. We will first proceed with a gentle flexion of the leg, meaning we are pushing the leg toward the front of the body, or the cranial aspect of the body. Then we'll proceed with a gentle extension, where we will pull the leg to rotate the hip joint as the dog was running, for example. We are pulling the leg away from the body in the direction of the back, or caudally. Then we can do the same on the other axis of rotation in the hip joint. We will adduct the leg by pushing down the leg toward the body. Then we'll abduct the leg by pulling it toward the top of the body, opening the hips. If the range of motion seems limited or inferior to what a healthy joint will be, we can then take a set of radiographs to have a picture of the hips, and to see if the femoral head does or does not fit properly in its pocket. Usually, a single view is enough to establish a diagnostic of hip dysplasia. For a good picture to be taken, we will want to hold the dog on its back and to stabilize him with a boat, for example. Because the dog is on its back, the view is called a VD, for ventrodorsal, meaning that the X-ray used to take the picture will traverse the dog from its abdomen, or its belly in non-medical terms, to its back. For example, if the dog were to be held sternally on its abdomen, the rays would then go from the back to the abdomen, and we will then call this view a DV, for dorsoventral. We want to pull the legs in order to extend the hip joints and to flatten the joint. We also want to hold both legs and to rotate them toward the inside to have the bones and the joint as straight as possible, to have the best view as possible. The shape of the femoral head, or the epiphysis of the femur, located at the very end, will be looked at to determine if yes or no it is properly formed and if it does or does not fit properly in the acetabulum, which is a pocket in the pelvic bone. Because each patient is different, there is no easy way and an easy answer to treat hip dysplasia. Generally speaking, the pain and discomfort can be managed with medication. It is also very important to keep the patient on a healthy weight, because being overweight will put more effort on the joint and on the legs, which will cause more pain. It's also important to keep a good muscle tone. It is very important to have the dog being active and properly exercise. However, too much exercise could also trigger very bad pain in the legs as well. If needed, we also can perform a surgery called a FHO for femoral head osteotomy, which basically consists as cutting off the head of the femur. But the best would be to have your dog assessed by a professional and then discuss appropriate treatment. Thank you for listening.